Ganglion cysts are soft, fluid-filled lumps that usually develop near the joints or tendons of the wrist and hand. They often resemble a small water-filled balloon attached to a stalk and contain a thick, clear, jelly-like fluid. These cysts are non-cancerous and generally harmless, and in many cases they disappear on their own without treatment. However, if the cyst causes pain or restricts hand movement, medical treatment or surgical removal may be necessary. Causes. The exact cause of ganglion cysts is not fully understood, but they are believed to form when synovial tissue protrudes outward from a joint or tendon lining. They are more common in women and individuals between the ages of 15 and 40 years old. Conditions such as osteoarthritis, previous tendon or joint injuries, and repetitive stress on the wrist may increase the risk of developing these cysts. Symptoms. A ganglion cyst may appear as a noticeable lump beneath the skin or remain hidden. Some cysts are painless, while others may cause discomfort. If the cyst presses against a nearby nerve, symptoms such as pain, tingling, numbness, or muscle weakness in the hand or fingers can occur. Diagnosis. Your doctor will usually diagnose a ganglion cyst through a physical examination. Gentle pressure may be applied to evaluate tenderness or discomfort. A light may also be used to determine whether the lump contains fluid or solid material. Imaging studies such as X-rays, ultrasound, or MRI scans may be recommended to rule out arthritis or tumors. Diagnosis can be confirmed through aspiration, where a thin needle is inserted into the cyst to withdraw fluid. The extracted fluid is typically thick, clear, and translucent. Conservative treatment options. Many ganglion cysts resolve without any treatment. If symptoms are mild, your doctor may recommend using a wrist splint or brace to reduce movement and allow the cyst to shrink naturally. Aspiration is often considered the first treatment option. During this procedure, the skin over the cyst is cleaned and numbed using local anesthesia. A needle attached to a syringe is inserted into the cyst to drain the fluid. Afterward, a steroid medication may be injected to help reduce the chance of recurrence, and a bandage is applied over the treatment area. Surgery. If conservative treatment fails and the cyst continues to cause pain, numbness, tingling, or limits daily activities, surgical removal may be advised. The procedure can be performed using an open surgical method or through minimally invasive arthroscopy, where a small camera helps the surgeon view the area clearly. Surgery may be done under local or general anesthesia. After cleansing the area, the surgeon makes an incision over the cyst and removes both the cyst and its root. The wound is then closed with sutures and covered with a bandage. Postoperative care. Both aspiration and surgical removal are outpatient procedures, allowing patients to return home the same day. Following surgery, most individuals can resume normal daily activities within 2 to 6 weeks. The hand is usually bandaged and supported in a sling. Medications may be prescribed to reduce pain, swelling, and stiffness. If stiffness or discomfort continues, additional occupational or physical therapy may be recommended. Risks and complications. Ganglion cyst removal is generally considered safe and carries a low risk of complications. Recurrence rates are approximately 20% after aspiration and around 10% after surgical removal. If the cyst returns, surgery may be recommended again. Although repeat surgery lowers the likelihood of recurrence, it may slightly increase the risk of injury to nearby nerves. Conclusion. Ganglion cysts are fluid-filled sacs commonly found in the hands or feet. Although they are usually harmless and may disappear on their own, treatment may be required if they cause pain, weakness, or restricted movement. Both non-surgical and surgical treatment methods are effective and are associated with minimal